Hello, my name is Sun Lu from Shanghai Lung Cancer Center, Shanghai Chest Hospital, Jiao Tong University. Welcome to this video abstract. Despite the increase in treatment option for patients with squamous cell carcinoma of the lung, option for patients in China with stage 4 after progression on palliative chemotherapy are restricted to docetaxel, gemcitabine, fludarabine, or ifosfamide. Because mutation of the EGFR receptor or EGFR are not common in squamous lung cancer, physicians have not attempted to consider EGFR targeted therapy. But 60 to 80% of the squamous lung cancer tumors express EGFR receptor, and other members of the HER receptor family have been implicated in the genesis of squamous lung cancer. So there is a clear biological rationality for evaluating agents that target HER signal pathway. The HER family block Afatinib is approved in several countries for both non-squamous and squamous non-small cell lung cancer. The global LUX-Lung clinical trial involved patients with advanced lung squamous carcinoma with progression after 4 or more cycles of platinum-based chemotherapy. Patients were randomized to 40 mg Afatinib or 150 mg erlotinib once daily until disease progression or unacceptable adverse events. There was significant improvement in patient-reported outcome and progression-free and overall survival with Afatinib versus erlotinib. The safety profile of Afatinib was predictable and manageable. Based on these results, Afatinib was approved in this setting most recently in China. Here I will describe a post-hoc analysis of patients from China enrolled in LUX-Lung study. A total of 795 patients were enrolled, and included 67 were from China. 36 of Chinese patients received Afatinib and 31 erlotinib. Although the size of the Chinese subgroup was relatively small, the baseline characteristic of the global appeared similar to those of the overall study population, with the exception of age. And compared with the erlotinib arm, higher proportion of patients in the Afatinib arm were elderly. Our analysis of Chinese subgroup identified trend toward improved in survival with Afatinib versus erlotinib. For progression-free survival, and hazard ratio was 0.7 in favor of Afatinib, equivalent to 30% reduction in relative risk. The hazard ratio for overall survival was 0.69, also in favor of Afatinib and equating to 31% reduction in the risk of death. The median overall survival was 10.8 months with Afatinib versus 8.1 months with erlotinib. This exploratory subgroup analysis was conducted to evaluate whether outcome in Chinese subgroup were consistent with overall trial population. Due to the limited number of patients in the Chinese subgroup, we did not expect to identify significant difference between treatments. As shown by the forest plot, survival outcomes in the Chinese subgroup were consistent with overall population. In the Chinese subgroup, the objective response rate was 8.3% for Afatinib versus 6.5% for erlotinib. The disease control rate was 56% versus 42%. The rates were similar to those calculated for the overall trial population. Overall, 21 patients remained on Afatinib for 12 months or more. As shown here, 4 of those come from China. At data cutoff, 3 of 4 were still receiving treatment, One of the 31 Chinese patients randomized to erlotinib remained on treatment for 12 months or more. Approximately a half of Chinese patients who received afatinib had an improved in global health status and quality of life versus 31% of those who received erlotinib. This is comparable to the overall trial population, but in Chinese subgroup, the difference was not statistically different, probably due to the small sample size. There were also improved in patients' reported outcome with some difference favor afatinib. The most frequent occurring adverse events were similar between the Chinese subgroup and the overall population. The most common were diarrhea and rash and acne. Although there were common, no patient discontinued due to either event. This suggests that clinicians were able to manage the impact of these adverse events, possibly by use of a tolerability guide dose adjustment for afatinib. Of the 36 Chinese population who received afatinib, 5 required dose reduction due to an adverse event, 3 within a month of starting treatment, and 4 discontinued treatment. In conclusion, our results suggest that afatinib is a viable treatment option for Chinese patients with advanced squamous non-small cell lung cancer following progression during or after platinum-based chemotherapy. Thank you very much.